Hi, everyone. We'll get started in just a moment. So we're going to give people another minute. It's not quite the top of the hour. We'll give people a couple minutes to log in. So we had quite a few people registered for this event. So we'll give them a little bit longer to log in. It used to be that everybody logged in 5 or 10 minutes before their webinar when they were once a week, but now that they're 3 times a day. now that they're 3 times a day and things to go to and meetings to see and information to gather. We'll give people another minute to log in, and then we'll get started. Hope everybody's doing well this Thursday morning. I'm actually visiting my family for the first time in 15 months, which is fantastic. And so it's lunchtime for me. I'm in Florida. Don't say anything. I know. Any crazy news story happens, could be that it's out of Florida. Very likely. All right. Well, let's just keep admitting people. And I think we can start we're already recording. Great. I want to welcome everybody. My name is Heidi Pickman. I'm the VP of Programs and Policy at CAMEO. In case, for those you don't know me, many of you do. I recognize a lot of names on this call here. Just so everybody knows, this will be recorded and you are more than welcome to share it with your colleagues, your clients, whoever needs to get this information. We will be sending you the slides. What I'd like you to do, if you can, is in the chat, type in your name and organization and where you serve. We'd love to see, get an idea of who's in the room. While you're doing that, I just want to give a couple of CAMEO updates. We're going to be scheduling our next microlending essentials. So your name, if you could type your name and org in the chat, that would be fantastic. Our next microlending essentials is going to be sometime this summer. We're settling on a date. Probably this week. So if you're interested and want to get on in the early part of registration, because they do sell out, please email Lisa. She'll type her email into chat. As well as I want to mention that on June 8th, we'll be having our advocacy day. We hope to have people from the federal side as well as the state leaders, and we'll be meeting with legislators. So please register for that and support our advocacy work. You can, if you're just joining us, please do type your name and org and where you're serving into the chat room. This is great. It's great to see some familiar faces. And you see Sarah and Alex. We've been having lots of communications with you all, and nice to meet you, Francisco. You're new to me, so Frederick Storer. So welcome. And Lewis from 3 Core, hello. Laura from SCORE, thanks for seeing you. It's been a couple weeks and glad you're chiming in with us here. So if we can, I'm just going to go quickly over the agenda while the rest of you type your name into chat. And if we can go to the next slide, please. We've done the welcome. And first, we're going to start off with some national survey results about small businesses and what they think about the vaccine. We have Tammy Halevy from Public-Private Strategies, long-term colleague of mine for almost the whole time I think I've been at CAMEO. She used to work for our mother type organization, our national organization, Association for Enterprise Opportunity.
North Coast,
private strategies. And then we have a stellar lineup from the state to talk about how to open safely, what you need to know, where we're at, what you need to know, what businesses need to know. And we have someone on who's able to answer some of our questions. So we'll have Willie Redmond, he's from the California Department of Public Health, and Erica Monterosa from the Department of Industrial Relations, and Trudy Raimundo also from the California Department of Public Health. So with that, before we move on, let's see where everybody's at and how much you know about where we're at with COVID here. I'm going to launch a poll and want to know if you know what color tier your county is in. Is it purple, red, orange, yellow, or you don't know? So if you could type in, choose one of your polling. Wow, it looks like most people so far know their tier. Nobody doesn't not know. This is great. You guys are all on it. That's fantastic. Keep going. I'll give you another few seconds in case you don't know. And when action slows down, we'll end the polling. Give you another 5, 4, 3, 2, 1. I'm going to end the polling, and just so everybody knows, oh, we have one person who didn't know right at the very end. I'm going to share results. There we go. Am I sharing results? Can someone see? Tell me if they see the results. There we go.
Yep.
Okay. So a lot of you are in orange. More than half of you have moved to the yellow tier, and one person doesn't know. I am going to assume that other people are just either on the phone or walking around and doing some multitasking. So totally understand. That's great. We are getting close. We are getting close to green. And that is really good news for everyone. I stopped polling, right? And I am going to now turn it over Tammy Halevy, who's going to talk to us about, you know, we can get everybody to the green. I would say once we all get vaccinated, or we get more people get vaccinated. I know there's all sorts of statistics out there. I'll leave that to the expert. But for now, let's turn it over to Tammy and talk about why vaccines and getting vaccines are important for small businesses. So Tammy, take it away.
Thank you so much, Heidi. As you said, I've known CAMEO for years, and I think the work you all do is incredibly important, and it's nice to see many familiar organizations. I will say that you all in California and the way you're organized is a model for the country, and I think you know that. I am delighted, if you can go 2 slides ahead, that would be great. I am delighted to join the conversation this afternoon. I don't want to take a lot of time, but I wanted to share a little bit of context for our perspectives, tell you about a national survey that we released last month in partnership with the U.S. Black Chambers, the U.S. Hispanic Chamber, and National ACE, and tell you a little bit about a small business campaign that we launched in response. So if we go to the next slide. In March of 2020, when COVID first started closing down the economy, we brought together a group of diverse stakeholders at the time to simply share information about what folks were seeing and, more importantly, what they were planning to do. That meeting drew about 60 people representing a whole range of organization types, from business advocates to corporates to philanthropy. And that has evolved into an initiative that we call Reimagine Main Street, that's intended to ensure an equitable recovery for small business owners and the people who work for them on main streets and MLK boulevards across the country. It's a combination of a network, data-driven insights and engagement, with policymakers, with the public, and with others. If you go to the next slide, you'll see a representative sample of the participating organizations. It's a diverse group. Different vantage points come to the table, but everyone shares a commitment, as I said, to equitable recovery for Main Street small businesses and their workers. If you go to the next slide, we didn't necessarily intend to focus on vaccines. We're looking at essentially 3 issues to ensure equitable recovery: vaccines, access to capital, and access to digitization. It goes without saying to this group and to most that that the pandemic hit Main Street hard. And we know that vaccines are a critical step to getting back to business. As we looked around and saw efforts to promote vaccines, we saw 2 things were happening. The first was that most of the efforts, rightfully so, were focused on individuals. The other piece, that where there was organization, it was in the business community, it was primarily focused at large employers working with their employees. And what we know is that that approach would miss the important role of small business and small business owners. Don't need to tell this group, 100 million people are either owners or employees, and business owners tend to hold an incredibly trusted voice in their communities. So the Reimagine Main Street initiative and our partners, the 3 chambers and others who participate, fielded a national survey. It's about 3,300 and change diverse small employers. It was fielded from February through March. And what we were trying to do was fill gaps in insights into the attitudes and preferences of small employers related to vaccines, particularly with the ability to disaggregate and understand whether there were differences by race or ethnicity of the business owners. I will say that a disproportionate portion of the 3,300 are in California, so you can pretty safely assume California was the largest share of the sample was from California, so you can pretty safely assume that the findings I'm going to share are reflective of California. It wouldn't be the same answer if we were in South Dakota. We can go to the next slide. 3 takeaways, primary takeaways from the survey. The first is that small business owners are thinking about vaccines. They're on the minds of most small employers and their employees, and they think about vaccines as important to get back to business. Small employers want their employees to get vaccinated, and they're willing to take a range of actions to make it happen. And finally, small employers, like the rest of us, want science-based guidance, largely free from politics, for both their employees and their communities. And they expressed eagerness to work with trusted partners. There's a ton of richness in the survey data. It's posted online for folks who want to see it. But let me quickly take you through some of the highlights. If we can go to the next slide. You'll see that more than 64% of small employers say that it's very important for their workers to get vaccinated. You'll see that that is the highest among API business owners and Latinx respondents, but it is nearly the majority across all segments. If we go to the next slide, you'll see that not only do employers think it's important for their employees to get vaccinated so that they can get back to business, workers are turning to their employers with questions about vaccines. So we see that overall, half of the employers in the survey reported that their workers were asking questions. You can see that Black or African American small employers reported the highest rates of inquiry. It's also interesting to note that AAPI, Black, and Latinx small employers reported getting questions from their workers at rates that exceed twice the rate of their white peers. This could reflect a higher degree of trust that workers have in their employers. It may reflect the absence of trusted sources about vaccines among these workers, we just don't know. So if you go to the next slide, you'll see that 2/3 almost of small employers told us that they are likely to encourage their employees to get vaccinated. That rises to more than 3/4 at 77% among the AAPI small employers. And you'll see that the hesitation is highest among Native small employers. What I will note is that at the same time we fielded this survey, Pew fielded a survey of individuals, and while vaccine hesitancy across segments is somewhat similar, small business owners are less hesitant overall than their non-business owning peers. If we go to the next slide, so business owners think it's important, they're getting questions, they want their employers employees to get vaccinated, and they're willing to take action. More than 80% of all of the small business owners that responded told us they would do something. The highest portion of business owners are willing and interested in providing educational resources to answer questions that their employees had. Similar rates are willing to provide paid time off to get vaccinated. And I will note that that willingness to provide paid time off was before the federal tax credit for paid time off for vaccinations. So I suspect that that number would get higher. A relatively small portion of employers intend to require employees to get vaccinated. It's 19% overall, rising to just over 1/4 for AAPI business owners. And interestingly, almost 1 in 5 Black business owners intends to or willing to pay a financial incentive for their employees to get vaccinated. Next slide. So what we heard from business owners was that that 2/3 were working with their local health departments or chambers of commerce or similar business support organizations around the pandemic. 1/4 who weren't working with local resources said that they would welcome resources. So we responded to all of this data by creating a campaign for small business owners to play the role of what we call vaccine leaders. More than 500 business owners across the country took a pledge to take action in a variety of ways, both to get vaccinated themselves, to promote it among their employees, to promote vaccines in their communities, in some cases to use their places of business as vaccine sites. We created a website with tools and curated resources, including tailored and culturally competent tip sheets in 5 languages: English, Chinese, Korean, Spanish, and Vietnamese. And you can access that content at www.reimaginemainstreet.org, vaccine resources. With that, let me hand it back to Heidi. Happy to take questions now or at the end of the conversation. And Heidi and the team will distribute the survey findings if it is of interest to anyone. Thanks so much.
Yeah, thanks, Tammy, for that. Definitely that great perspective. It'd be interesting to hear from you. I have a question from you all to hear if this is what you're hearing on the street, from your clients. You can just type into chat. I don't want to spend too much time, but if anybody has any feedback as to whether this resonates for you all. Are you hearing from your business owners that they want information about the vaccine? You can type into chat if you have heard or haven't heard or not. If I don't hear from anybody, I think we will move on. Thank you, Tammy, so much. I think this is, SCORE is not hearing from business owners. Susan hasn't heard from clients, but has from colleagues. Well, you all are small business owners yourselves, right? So thank you for that. Not too many vaccine in far north of California. Yeah, Lewis, you're up in Chico. No increase. Interesting. Well, this, like Tammy said, these survey results do reflect California business owners as far as the survey is concerned, because it was heavily influenced by the respondents were heavily weighted toward California. So we will pass on that information and you can get that out to your business owners. But with that, I'm going to turn the rest of the program till we're ready till we're ready to take questions over to Willie Redman. He's the External Affairs Office from the California Department of Public Health, and he is going to talk to you more about state-specific issues regarding vaccine, and then we'll go into some important things we need to know to open. So, Willie, take it away.
Awesome. Thanks so much, Heidi. Appreciate it. I'm going to pull up my screen. Give me 1 second. See if the technology cooperates today. How's that for everybody?
Technology is cooperating.
There you go. It's a win. Well, thank you again. Thanks, Heidi and team, for having us on. I speak on behalf of myself, Erica, and Trudy, who will be speaking momentarily, but we're really excited to be here. And I think, Tammy spoke to so many of the important issues that small businesses are facing. And, I'm thankful to say that we've developed a lot of educational materials and resources that I'll touch on shortly that will hopefully be helpful in you all and sharing with, with your clients and other folks that we can, use to continue to educate folks as we get, as Heidi mentioned, closer to that green, which we're all, I know, eager for very much. So today I'm going to go through just some quick vaccine updates. Erica is going to speak to some of the work that the Department of Industrial Relations has been doing around employer resources for COVID. And then Trudy, who's going to be joining shortly, is going to speak to what that, the color-coded system that you're all very familiar with by this point, the blueprint, what that means, where we are in the process, what it looks like as we move towards June 15th. So that's kind of our agenda for the day. And so just a quick update on where we stand in California. As of today, these numbers are actually from the last hour, today's daily post. We're still receiving about 2 million doses a week. Obviously, this will continue to hopefully change or increase as the federal vaccine allocation strategy changes as well. California will be adapting to that. We have more than 31 million vaccines administered to date, more than 13.4 million people fully vaccinated and 6 million more partially vaccinated. And what that means is about 61% of adults are at least partially vaccinated as of today. So making good progress. We obviously have some big goals for June 15th, and then obviously the marker that President Biden set for the 4th of July as well. So we're marching towards those numbers. And as of now, we are averaging nearly 270,000 doses administered per day, which I believe is somewhere in the range of about 100,000 more than any other state in the country. So just a quick update on, yeah, right. A quick update on Johnson & Johnson. I'm sure, this has been in the news obviously for several weeks. You're probably well aware of this, but just a kind of a reminder in case you hear any questions or field these questions, the pause that the FDA had instituted was lifted on April 23rd. The Western States Scientific Review Work Group, which is the one that represents California and a few other West Coast states, aligned with that on April 24th, recommending the resuming of the vaccine. We do have educational resources on the Department of Public Health's website for anybody who has questions. There's a variety of fact sheets and other materials in several different languages. So that is linked here, and obviously Heidi will share the deck afterwards, but in case you receive any questions or are curious, that's a really good place to go. And also just to note that, of the nearly 8 million doses that were administered, there was only about a dozen or so reported cases of the rare blood clot that was seen. So just a note to touch on that because it was in the news, and I think it's important for everyone to have this information. And a reminder too as well, hopefully most people here are either signed up or have received their first dose or fully through the vaccination process. But for your clients or for other people in your network, everybody in California ages 16 and up is eligible for a vaccine as of today. My Turn is the website for the state where all the booking can be done. It's available in 14 languages, and there's also a hotline for those without internet access. And we have folks on staff that are working around the clock in over 250 languages that can assist with booking an appointment. I will note also there's new features being added to My Turn all the time. So including helping with transportation for folks that are homebound or have any sort of issues getting to vaccine sites. There's the ability to talk to somebody directly to essentially get one-on-one assistance with booking an appointment. So it's really a good resource. It's a great tool. Encourage that to be shared broadly for anybody who's looking for an appointment. Secondarily, the CDC's Vaccine Finder website is also a really good tool if you're looking more about in the pharmacies and those sorts of places. Between those two websites, there really is no stone left unturned as far as finding an appointment site. So these are linked out in the deck as well. And then lastly, I think this ties very nicely into what Tammy was saying, but it's really great to hear that small employers want the science-based guidance for employees and for their community, and that one of the things they're willing to do is actually share these because we have so many great tools. And I know Erica will probably share some of hers as well, but for the vaccine-related efforts, our team's website, which is vaccinateall58.com, has ton of information, not just on the vaccines themselves, how they were developed, how you can get them, what to expect after you're vaccinated, but then has a variety of toolkits as well. So social media assets, fact sheets, flyers, videos, radio spots, all in a variety of languages too. So we really encourage you to check this out, to share this around. This is getting updated all the time. And even this week is a big focus for our campaign is doing a week of action. So we're doing some special events, and even this afternoon, this information is on this website, but there's a Reddit AMA with our state epidemiologist, Dr. Erica Penn. And so things like this, we're continuing to push these out. So I would encourage you to follow us on social media and also to visit this website. Another tool I wanted to plug is Listos California has been doing some really great work in the state around outreach to disadvantaged and hard to reach communities. They have a ton of resources on their website as well around vaccine education. They have customizable flyers, which is the image you see here. And this is available in multiple languages. So if an employer wanted to download this, it's a PDF, and they wanted to customize it with information for their county or their city and share this with their employees on where to get a vaccine, how to get an appointment, any other details, you can download it straight from this website, email it out to your workforce. It's incredibly turnkey. So this is just another effort that's happening that I wanted to highlight. And there's a few others in the appendix that I won't touch on, but when the deck is sent out, there's some other links in there, including a link to sign up for our newsletter. So please take a look at that as well. And with that, I'm gonna go ahead and turn it over to Erica. Thank you.
Thank you very much, Willie. I'm really thrilled to be here. I want to give a little bit of information about our department, and you can go to the next slide. Our department, the Department of Industrial Relations, protects and improves the health, safety, and economic well-being of over 18 million wage earners in the state of California, and helps their employers comply with state labor law. Within our department, we have CalOSHA and the Labor Commissioner's Office, as well as the Division of Workers' Compensation. You can go to the next slide. And it's important that you understand California's labor laws do protect all workers, regardless of their immigration status, and that, you know, comes into play regardless of whether we're talking about workplace safety and health requirements, requirements to provide paid sick leave to employees, workers' compensation benefits and payments for those that have work-related illnesses or injuries, including COVID-19 illnesses. And we also enforce more than 40 retaliation laws, anti-retaliation laws. Next slide, please. So in terms of workplace safety and health, employers in California are required to take steps to prevent workplace safety and health hazards, including preventing infection with COVID-19. And so what this means is that employers must have in California a written injury and illness prevention program. This is a safety plan that is specific to the work site and looks at what hazards might exist and take steps to prevent those hazards, including training for workers in all languages, in a language that they understand, procedures to prevent workplace hazards, including regularly inspecting the work site, and it also must include a written COVID-19 prevention program that can be incorporated into that overall safety plan. And it's important that you understand that workers have the right to review their employer's written injury and illness prevention plan, including the COVID-19 prevention program. This promotes a safety culture where everyone understands that it's not only their right, but their responsibility to prevent workplace safety or prevent workplace hazards and injuries on the job, so that they can go home safe and sound at the end of their shift. Next slide, please. So when it comes to COVID-19 prevention requirements, some of the steps that employers have to take to prevent the spread of COVID-19 include providing workers face coverings and making sure that they wear them properly, training them on COVID-19 symptoms and the steps that are being taken at the workplace to prevent the virus, and benefits available if workers are sick or exposed. And it also includes taking a look at the workplace and making some modifications. So for example, to ensure that there's sufficient physical distancing between coworkers, as well as between workers and the public. And if it's not possible to keep everyone at least 6 feet apart, then what that might require is installing some barriers to help prevent the spread of the virus. And of course, also providing time and supplies for more frequent hand washing. Next slide, please. There are some additional requirements that employers have to take under Assembly Bill 685, which went into effect at the first of the year. And this is in regards to notifying public health agencies of all workplace outbreaks, which is defined as 3 or more confirmed COVID-19 cases among employees who live in different households within a 2-week period. And also employers have to notify all employees at a work site of potential exposures. And that includes within 1 day. And that's also have to provide information on the benefits available to workers that are exposed, the protections, and what the employer is doing to disinfect and take safety measures in response to a potential exposure. Ready for the next? We do have a wealth of resources on our website, as Willie mentioned, and do recommend that you look to our website. In fact, we just updated some frequently asked questions on Cal OSHA's COVID-19 prevention emergency temporary standards. And I want to let you know that those changes included advising that that workers who have been vaccinated and may have been exposed to COVID-19 only need to be excluded from the workplace if they are exhibiting COVID-19 symptoms or are confirmed to be sick with COVID-19. So in other words, those who've been vaccinated 2 weeks after their final vaccination dose, if they are asymptomatic and they've been exposed, they can still continue to work at the work site. Next slide, please. I also want to provide a little bit of information for you in regards to some of the paid sick leave requirements that have gone into effect this year. For those in your network that have 26 or more employees, there is a law that went into effect. It was went into effect on March 29 of this year, but can be used retroactively beginning January 1st. And it's in effect through September 30. And it's supplemental paid sick leave of up to 80 hours for COVID-19 related reasons. And so that can be if workers or their family members are sick with COVID-19 or are told that they must quarantine or self-isolate, to care for children whose school or place of care is closed due to COVID-19 on the premises, and to get vaccinated, tested, or recover from vaccine side effects. Now, this is in addition to the permanent paid sick leave that employers are required to provide in the state to most employees. Ready for the next? And a little bit of information about the permanent paid sick leave requirements. Most workers in California are required, are entitled, pardon me, to permanent paid sick leave under California law, and they bank 1 hour of paid leave for every 30 hours that they work starting the first day on the job. They can begin to use that paid sick leave after they've worked for 90 days for the same employer. And they qualify for California paid sick leave as a full-time, part-time, or temporary worker. They can use that to recover if they're ill, to get preventative care, and to take care of a family member as well. Some cities or counties require employers to provide additional paid sick leave hours, but the state says that employers must provide at least 24 hours or 3 days of permanent paid sick leave per year. Ready for the next slide. And a little bit of information about workers' compensation benefits in the state of California. Employers are required to maintain workers' compensation benefits or the acceptable alternative. And workers, it's designed to provide benefits for workers to recover from either work-related injury or illness, such as getting COVID-19 on the job. And these benefits do partially replace workers' wages, roughly 2/3 of the wages, while they recover, and also pay for medical care and to help them return to work as quickly as possible. Next slide, please. We've got a little bit of more information here about workers' compensation. If you are told, or if a worker believes they contracted COVID-19 at their workplace, they do have a right to workers' compensation benefits. You should encourage workers to notify their employer and file a workers' compensation claim if they think that they contracted COVID-19 at work. And when you become aware of the illness, you should provide your employee the workers' compensation claim form. We've got more information on our website available. So what happens after a worker files a claim? If they don't receive a letter on the status of their claim in 14 days, they should call the insurance company, the employer's insurance company, for an update, or the administrative firm that handles the claims. And if the employer does not deny the claim within 90 days, then the injury or illness is presumed to be covered. And we do have information here where folks can either call or find more information on workers' compensation requirements and benefits. And in a little bit more information about retaliation. In the state of California, there are more than 41 laws that the Labor Commissioner's Office enforces. And so it's important to note that if a worker's fired or their pay or work hours are reduced for using their labor rights under California's laws, that's retaliation. It is illegal. And it's illegal for the employer to threaten to report them to immigration authorities for following California laws as well. And so all workers in California are protected by labor laws regardless of immigration status. And that includes, activities such as filing a wage claim for unpaid wages, reporting an unsafe workplace or labor violation, speaking up about unsafe conditions or unpaid wages, refusing to work in conditions that are clearly unsafe, or assisting in an investigation of the employer with state agencies such as CalOSH or the Labor Commissioner's Office. And this is additional information in regards to how workers can file a retaliation complaint with the Labor Commissioner's Office. Generally, complaints do have to be filed within 1 year of the act. Finally, I want to make sure that you are aware of a wealth of resources for employers and workers we do have a website, saferatwork.ca.gov, which is part of the California for All campaign that provides detailed information for employers and workers on COVID-19 prevention requirements and resources, including a portal for employers to get specific information on their industry and the area that they live. And it does provide information for employers as well on how to provide a safer and healthier workplace, and what to do if a worker may be sick or exposed to COVID-19. And with that, I would like to turn the conversation over to Trudy Raimundo.
Erica, before we go to Trudy, can we go back to the last slide? I think that was a really good slide. And so if I understand you correctly, if our members have like serve either a small manufacturer or maybe a mom and pop restaurant or anything, what those restaurants will need to do is listed by industry on one of those, which that would be on the employer portal.
That's correct. Yes.
Great. Okay. That's really,
Yes.
because they work with so many diverse types of businesses. So that'll be really helpful resource. So
we have an informational video, as you can see by the picture here, but we also have a questionnaire that takes them through, you know, a series of questions asking about their industry and specifics, and gives them information as a result of the questions that provide a roadmap to how to get back to business safely.
Great. Excellent. Thank you. Okay, now we can turn it over to Trudy. Thanks for
Thank
your
you. Thank you.
Oh wait, somebody raised their hand.
Yes.
Again,
Hi. Yes. Just to clarify, I just want to make sure that I heard right. So if you've been vaccinated, you get in a situation that there are people or you understand that you might be you might have COVID. If you most likely you're not going to have any symptoms, so you can actually go to work anyways.
So if you are vaccinated, and it's, you know, I've received my second dose and it was over 2 weeks ago, so that then I'm fully vaccinated. The CDC adjusted their guidelines, as did CDPH, and CalOSHA just updated its frequently asked questions in regards to requirements for employers. And in normal cases, when someone's exposed to a COVID case at work, then, you know, anyone within that exposure, and that's, you know, more than 15 minutes within 6 feet, and that people are not using face covers, et cetera, then they are advised that they should quarantine for, and the employer's required, if, you know, if they're not able to telework, the employer is also and they're not sick, they're not showing symptoms. In normal circumstances, the employer is required to pay them their normal wages during that quarantine period. So the difference is that for those that are vaccinated and that are asymptomatic, they're not showing symptoms, they don't have any symptoms of COVID. If they've been exposed to COVID case, but they're fully vaccinated, there's no need for them to be excluded from work. So hopefully I was clear on that. And we do have that information.
Can you repeat the last time? Sorry, the last thing you said?
Yes. So the employer is required to pay for time it takes for testing or vaccination, and they're also required to pay for exclusion pay for workers. However, if the employee is vaccinated, fully vaccinated, then they're only required to exclude them if they are COVID-19 cases, in other words, that it's confirmed that they have COVID, or they have had a COVID-19 exposure and exhibit COVID-19 symptoms. However, employers do not need to exclude fully vaccinated employees who had a COVID-19 exposure, who are asymptomatic, who are not exhibiting COVID-19 symptoms.
That's scary.
That was just updated yesterday, and that is in, it's applying the new CDPH COVID-19 public health recommendations for fully vaccinated individuals. And what it speaks to is, you know, the effectiveness of the vaccinations.
Yeah, I mean, but for people that haven't been vaccinated, if you don't have any symptoms and you're just spreading the
If that's
the
right.
virus.
If you've not been vaccinated, then you must be quarantined, regardless of whether you're exhibiting symptoms or not.
But what I'm saying, I've been vaccinated, so I don't have any symptoms. I've been exposed. I'm not required to stay at home. So so I go, and for people that haven't been vaccinated for any reason, they're exposed to me, I'm going to be I don't have any restriction from actually, you know what I mean? It's very because I am vaccinated, then for people that are not vaccinated, well, you take care of yourselves.
Yeah, Daniela, I think the question becomes that the transmission rates of the probability that you're going to get it, even if you've been exposed to COVID, is so low. The science, that's what the science.
It's Leslie Williams.
And yeah, I think let's hear from the Department of Health.
By you and get your input. If you can call me back, that would be great. 916-203.
I'll put somebody on mute here.
Mute.
Let's call you back, Leslie. Sorry, Leslie, to call you out, but if you can mute yourself, there you go. I think that's a point we could probably turn to the Department of Health for some more on that, because I think that anyways, yeah, I don't want to say anything that is incorrect information. So I think this is a good time, unless Erica, you want to chime in as well, but I think we can turn it over to you guys, Becky, to answer this more fully. Unless, Sarah, do you have a question? I see you're kind of popping up here. You want to? No, okay. So.
Yeah.
I think
Sorry,
there's lots of questions about this, and I think because same here, Daniela. I'm vaccinated in my 2 weeks, and I'm nervous. I'm still like nervous is kind of I don't want, not so much for me to get sick, but yeah, you don't want to contribute to passing it. You don't want to contribute to the public health issues. So
yeah, well, and nobody's telling you that this is 100% that you are not going to get COVID if you are vaccinated. That's not true. So I could, and because I'm vaccinated, I feel like I can be without my mask and share maybe close spaces with other people, like at work, for example. And maybe you're not.
Can I interrupt there? Can I interrupt you there, Daniela? Yeah. It's still required at work sites that even those that are fully vaccinated, if indoors and if they're within 6 feet, they must maintain face masks. So they cannot be without masks in the workplace under employer requirements at this time.
Thank you.
And they're still urged and required to stay 6 feet away from each other.
Great. Thank you.
Thank you.
Let's get more in the science from Trudy. If Trudy's here, maybe she can give us some more insight into this big question, because I think part of it is everybody, I know I'm going to admit it, I have COVID PTSD about getting together with people. It took a lot for me to get on a plane and come visit my family in Florida. I double masked, and I had this pit in my stomach, even though I'm fully vaccinated. It's just, we've been living in, this stuff is real, and we've been living weird lives for the past year. So exactly, it's going to take a long time to get comfortable, as Susan said. So Trudy, you want to take it away and help us get some insight into this?
Sure. Hi, and good morning, folks. Trudy Raimondo, I'm the lead for external affairs within CDPH COVID response. And I know Willie invited me this morning to be able to talk to you a little bit about Beyond the Blueprint, but if I could take, kind of 30 seconds to address Daniela's concerns. But Heidi, you framed it kind of correctly. When you are fully vaccinated, the likelihood that you will also get, you will get severely sick is incredibly low, and really speaks to, I think, the effectiveness of our vaccines. The other piece that folks should also be aware of is that you're also you're at very low risk of also being a transmitter. So hence why, you do not need to be excluded from work because of the vaccines are working so well. The likelihood that you're going to get sick is incredibly low, but the likelihood that you're also going to be a transmitter of the virus, so beyond, is also incredibly, incredibly low. And typically that's why, prior to the vaccines, we ask folks to immediately quarantine when they were either exposed to a positive, or even if there was a potential, is because we didn't want that individual to be a transmitter as well and to continue to spread the virus. When you're fully vaccinated, you're also not a very good transmitter as well. And so hence why we say, you do not need to be excluded from work, because there's very low risk of you spreading it, even if you've been exposed and continue to be asymptomatic, because it's the symptoms that are going to tell you whether or not you're going to be a good transmitter of the virus or otherwise. And so that's why we very clearly say, if you're asymptomatic, because if you are symptomatic, you do still need to then be excluded and you should be quarantining. And even if you are fully vaccinated and you become symptomatic with COVID symptoms, we actually still recommend that you get tested. And so it's that symptomatic, asymptomatic piece, I think, that is really important for folks to understand. So hopefully that addressed some of the questions and concerns. And I get it, I've been at this for, I still remember that the first day we had our first COVID case in San Bernardino, where I'm based, it's ingrained in my head. And I get it. It's been a very long year for everybody, but I'm really encouraged at the efforts underway around vaccine. Really appreciate this conversation around really working with business entities like yourselves and groups like yourselves to continue to encourage and incentivize vaccines moving forward. I truly believe it is going to be our way out of this pandemic, and it's working well. I think it's going in the direction that we want it to go. We see that clearly in our current case rates, our test positivity, our hospitalizations, and those kinds of things. So I think we just need to stay on this track and continue this trajectory moving forward. So now, talking a little bit about the beyond the blueprint. So if we want to just project the next slide. Great, thank you. So this is really the only slide that I've got in terms of a presentation today. And I'm here to talk to you a little bit about what we are now referring to as beyond the blueprint. I think for many of you, you're probably wondering what happens after June 15th, with that Beyond the Blueprint memo that came out that really spoke to businesses being able to go back to quote unquote normal operations after June 15th. But I think it would be good to frame a little bit what we've been doing throughout the entire pandemic. I think as many of you know, and even as of recently, we continue to put out these industry guidance. Much of it, almost all of it, is tied to what we're calling the blueprint. So it's really tied to these purple, red, orange, and yellow tiers. The industry guidance is very specific. I think I lost count how many specific industry guidance we've got out there. Again, all tied to the blueprint, provides a lot of requirements as well as capacity limitations depending on the county that you happen to be in, as well as a lot of other recommendations, depending again if you are a restaurant, if you're a performer, if you're audience, those kinds of things. What happens essentially when we move beyond the blueprint is with the blueprint going away, and so these tiers, these things that you're so familiar with right now, this purple, red, orange, and yellow, all of that gets retired. And so what essentially happens is all of that kind of thick industry guidance that's tied to the blueprint gets retired as well. With the idea being that, again, we expect businesses to really just go back to normal operations. I do want to caveat, something that's really important to point out is that, all of this is really contingent upon the vaccines doing what we expect them to do. which is create herd immunity, really start to continue this trajectory of lower case rates, continue our trajectory around low test positivity. I think I heard yesterday that California has the lowest case rate in the nation. So, you know, we want to stay there and we want to continue down that path. We want to make sure that we continue to monitor our hospitalization rates very closely, and make sure that, you know, we're not looking at what is happening, you know, in other parts of the nation as well. But it looks like we're on a great path. We've done such immense efforts around vaccinating, you know, so much of our population. And I think, you know, I think we're going to get there in terms of June 15th. So if everything goes the way it's supposed to go, the tier structure will be retired. Consequently, all of those kind of thick industry guidance that's really been telling businesses how to run and how to function will be retired as well. What we will be following up with, though, post June 15th are additional requirements and recommendations. And I think we alluded to it in the Beyond the Blueprint memo. I think there's some very specific instances. Even in that memo, we referred to indoor conventions and conferences with 5,000 people. We know that there are going to continue to be events, situations, activities that we would still consider to be high risk. Oftentimes it's large indoor events because we've always said indoor is always much riskier than outdoor. We also know that there are going to be events where there are going to be instances of what we're calling uncontrolled mixing with thousands and thousands of people, you know, anywhere from 10,000 folks and up. And so after the blueprint is retired, we will continue to have some restrictions and recommendations on those very, very large events where we still think there's a lot of high risk to them, mainly again around some indoor events. And the reason for that is, again, because of the sheer numbers, because oftentimes it will draw from outside of our local community. Oftentimes it will bring in folks from out of state, sometimes international travelers as well. It will typically last multiple days, so not just a single day event. And so it's those kinds of risky situations that we still want to very closely monitor and provide some requirements and recommendations around. What those requirements and recommendations are going to be focused on, though, are really just masking. I think for all intents, even, you know, as Erica had stated, even with the Cal OSHA ETS, masking is still a requirement, vaccinated or otherwise. That is really, I think from the very beginning, has been one of the most important mitigation measures we put into place. And even the CDC recognizes that simply because of the way it's spread. And it is the way it's spread through these kind of aerosols and droplets. And so masking is going to be incredibly important and required in any sort of indoor setting, whether, you know, you're vaccinated or otherwise, especially in large settings, because the population you're mixing with is unknown. You know, it's what we refer to as unknown status. You don't know if you're mixing with fully vaccinated, with unvaccinated individuals. So it's really an attempt to continue to protect yourself and those around you as well. So we're going to continue with requirements around masking. Hopefully all of you saw that we posted recent masking guidelines earlier this week. Testing and vaccination is also going to continue to be either a requirement or a recommendation in very large high-risk settings. We're not giving up on testing, and I always try to, you know, remind everybody testing is another really important mitigation measure. I know we've seen, I think, some drops in our testing numbers, but hopefully it's because many folks are really going to getting vaccinated as a result. But there's still a role for testing because we know there will always be a segment of our population that will remain unvaccinated. And so testing will continue to be an important requirement in again, very large high risk settings. And then I think moving forward, you know, CDPH as an entity, we're going to go back to what I call the basics. We're always, from the very beginning, our focus has been population-based and really around preventative measures. And so many of the industry-specific things that you are used to seeing will be replaced with broader population-based preventative recommendations and mitigation measures to continue to protect our entire population, rather than getting into the weeds in terms of trying to tell industry how to kind of run their business. I think the only other comment, I would make, and this is really goes to some of the comments we heard recently. I think folks are still a little wary. We've been at this for a really long time, and we know that there are also going to be segments of the population that probably won't get vaccinated. And so what we would hope and encourage businesses to do, even though we're not putting out industry guidance, is to continue to provide options for individuals, whether it's making sure that you're still providing options to do outdoor eating in a safe environment. We know that there's going to be that segment of the population, and we think businesses will do that. Continue to provide those options that we focused on as a mitigation measure, but now, we're not getting really specific, but continue to really want to emphasize that businesses, think about providing those safer options for their customers and their clients as well. Because again, it's going to be some time before, folks start to move a little more normally, I think, or I think, caution is still going to be really important even after June 15th. It's not as if COVID just magically goes away. I think all of us would wish it did, but COVID will still be there. And so we'll still have, those recommendations. I really encourage businesses to continue to provide safe options for their customers and clients, knowing that COVID is still there come June 16th. So that's really all I've got to share in terms of what we're looking at for beyond the blueprint, certainly from an industry perspective, and then kind of generally where, as a department, CDPH is going for the future.
Sure. Trudy, do you all have just a couple of minutes to stay on and answer a few questions? I know we're at time here.
Sure, of course.
Okay, great. I think you've answered Nancy's question or comment about Willie. If we'll make sure we could maybe have you stop sharing your slides and pop your email into and we can just talk to everybody here. You kind of mentioned that the blueprint's going away, so it'll be left up to the basically the individual business. So there's going to be what it sounds like to me, there's going to be encouragement by the state, but not requirements to work for the communal good, but it's going to actually be up to the individual. Is that what I'm hearing you saying?
Yeah, I mean, for the most part, businesses, will go back to what we call normal operations. We still want to encourage businesses to, again, leave some safe options for customers and clients. And then we'll have, again, broad public health recommendations and some requirements. So masking, I think, is going to be still really important. Testing, vaccinations, those kinds of things. And even moving forward, we're starting to come up with some more comprehensive kind of testing guidance to really provide businesses and our larger community what their options are around testing. How you verify testing. Vaccine verification is probably at the foremost in terms of questions from these folks. We're working really closely and monitoring what's happening at the federal level to be able to address, and how do we establish kind of some statewide standards around vaccine verification as well.
Great. And then
can I add to that? This is Erica.
Yeah, sure.
Yeah, I just want to clarify also that under Cal OSHA regulations, there is an emergency temporary standard for COVID-19 prevention in place. And so that is in place. And in fact, the Occupational Safety and Health Standards Board that promulgates those regulations will be posting tomorrow on its website some proposed changes to the standard that Cal OSHA, the Division of Occupational Safety and Health, submitted to them. And it will be taken up at their May 20th public meeting. So I invite you to visit our website at dir.ca.gov tomorrow and look to the Standards Board web pages for information about that.
Erica, can you repeat, what is it, dir.ca.gov?
That's correct. D as in David, ir.ca.gov.
Right, Department of, okay, great. And then we'll make sure to send that link. And then there's a, I just want to ask a question about, so like if someone's put up like barriers, I know I've been in a couple of stores, you know, that they put up barriers between the cashiers or whatever. Will those be left in place or taken out, or like what should we advise our clients to do regarding that? I mean,
I think that they should, you know, in terms of workplace requirements, I think they should, you know, refer to the current standards that are in place, which are on our website, dir.ca.gov, and then you can go to CalOSHA, or you can go to saferatwork.ca.gov, and that will also take you to that information. And then again, in terms of the proposed changes to the standard, that will be addressed during this public meeting that's occurring on May 20th with the Occupational Safety and Health Standards Board. They're the group that promulgates regulations for CalOSHA within the state of California.
right.
And thank you for that. I do want to continue to emphasize, thank you, Erica, you know, for employers, really that your guiding entity is really CalOSHA and those emergency temporary regs. For CDPH, you know, ours are going to be kind of broad recommendations for the general population, those kinds of things, but definitely, and we've been working incredibly closely. CalOSHA has been a really great partner, making sure we're in alignment and referencing back, you know, when somebody's got this guidance or somebody's got this particular regulation, and always making sure that we're in alignment.
Yeah, it looks like some people are erring on the do no harm, be safe, you know, you can't do wrong by being safe. And I think that's, you know, for me, that's how I like to operate, but it seems like some other people might be feeling that way as well. Just one last question posed by Nancy about herd immunity. She's, you know, national experts have been saying that it's not even possible just with the amount of people who are vaccine hesitant and the children not being vaccinated. Is that still a goal? And can states reach herd immunity before the rest of the country, or does it have to be countrywide, or how is that?
And I think, you know, we always want to, you know, go for this goal of herd immunity. I mean, we acknowledge that there is currently a lot of vaccine hesitancy around there, but I think with groups, you know, and the work that's being done, like with the Vaccinate for All 58 campaign, those kinds of things, we're starting to be really mindful and being intentional about how to address that vaccine hesitancy. You know, we're happy, I think the feds announced that they are looking to announce early next week, you know, the approval for a vaccine for 12 to 15. So we're already kind of gearing up on what that's going to look like, prepping, you know, those trusted providers, those trusted messengers, you know, in order to be able to carry our message and be able to really fill out our network to ensure that portion of our herd steps up and gets vaccinated and that they all have appropriate access. But more importantly, I think access in arenas where they're most comfortable. You know, I think that's the other piece that we want to be really mindful of, especially with, you're talking about kids. Let's really create an avenue where they're most comfortable normally getting their vaccine. So it's working with our normal pediatric providers, our Vaccines for Children network, those kinds of things. So, you know, I never want to say we're never going to get there because of the hesitancy. I think there's, you know, we should never let go of that goal of reaching herd immunity. And we just need to be intentional about, you know, kind of the strategies we put forward on how to address current vaccine hesitancy.
Right. Well, we didn't get a chance to answer every single question, but we're way over time and I know people have to get back to work. So I want to thank Our friends at the state of California, Erica, Willie, and Trudy, thank you so much. We do have the PowerPoint that we'll be sending around, which has Willie's email address in it, and we can field some questions through there. They gave us lots of great resources, as well as Tammy's survey. There's toolkits to send to your business owners. You know, everybody's going to handle this the way they feel personally comfortable. And if you want to err on the side of caution, more power to you. Thank you, everyone. We'll see you next time. I'm not sure when, but soon. And if there's more demand, we can have you guys back for a question and answer session when we know more, you know, when people might have more questions about, hey, can we do this? Can we do that kind of thing?
To do it.
Ask your clients if what their concerns are, and we'll see what we can do.
Thanks,
Heidi.
Everyone. Yes.
Great. Thank you.
Thanks,
Bye,
everybody.
everyone.